Welcome back to my channel. My name is Aamna. I'm a fourth year veterinary student, and in this video we are going to talk about the intensive care medicine. So basically, after providing the anesthesia to the animals or after performing the major surgery, the animals are brought in the intensive care units, or sometimes known as critical care units as well. So over there certain medications or certain medicines or certain protocols are applied. So in this video we are going to talk about that A, B, C, D and F. So before talking about that, let's talk about the principle of the surgery, right? So the first principle of the surgery is to provide a safe anesthesia, right? And as we know that the safe anesthesia does not only depend upon the drugs, it also depend upon the veterinary anesthetist, right? So the experience of the veterinarian, so the experience along with the knowledge of the veterinarian matter a lot in providing the safe anesthesia. Another thing we talk about, the anesthesia should be cheaply available, and should be easily available. If you are living in a particular and local area, and if the doctor recommended you to bought anesthesia which is not available in that local area, so it should not be the case, right? So the anesthesia should be easily available in your local area, and it should be reversible, right? So here we go. Here are the A, B, C, D, and E and F. They are very important, and they are mainly applied in the intensive care unit. And A stands for the airway open. As we know that in the respiratory system, there are the airways, and if they are blocked, the animal cannot respire normally. And when the respiration blocks, then animal is going to go towards the death. So in the intensive care unit, the doctor or the veterinarian has to make sure that the airways should be opened and the breathing should be normal. There should not be a bradycardia or the tachycardia. If such type of the things happen, then we have to manage it with the help of the medications which are used in the intensive care, right? Circulation, right? Circulation should be normal, not the upper than normal and not the lower than normal. It should be in the normal state, and we have to make it normal by using certain medications as well. Certain drug therapies are used in intensive care medicine, and electrolytes are used if the loss of the electrolyte has occurred. So in the electrolyte, normal saline NaCl is provided with the drip. Another thing is that fluid therapy as well. If the dehydration occurred in the animal, so we have to move forward toward providing a fluid therapy to the animal so that the normal mechanism inside the body should be maintained. If we talk about the airway, so patient admitted to intensive care requires some respiratory support, and that respiratory support is given with the help of the ventilators. So ventilator, as number one thing, it should be kept in mind is that the ICU, right, intensive care unit, is already equipped with certain technologies that are used that are used to maintain the life of an animal. So the ventilators or the certain type of the technologies are already available in the ICU system, ICU unit. So the for the respiratory support, ventilators are provided to the animal. If we talk about the breathing, if we have to check the animal is not having a normal breathing, then we have to move forward toward that process, that technique or that procedure, which is known as CPR. CPR stands for cardiopulmonary resuscitation, and with this you can maintain the cardiac as well as the pulmonary problems in the animal. If we talk about the circulation, if there is circulatory problem, then we have to move forward this procedure. CRT stands for capillary refill time. So here the picture depicts all the things. This is the time that it takes for the gums to return to the normal pink color after you press them. What you have to do, you have to just open the mouth of an animal like this doctor has done, and you have to just put your finger on the gums of an animal, and if they are returning to the normal pink color within 1 to 2 seconds, then they are considered at a normal stage. But if it takes more than 3 seconds or the 3 seconds, then the animal is in the emergency state. The animal is having the dehydration, the animal is not having a proper circulation in the body. So these are certain things to know about where the animal is having a circulatory problems or not. So the drug therapy, mainly if you found that the heart rate is low, there is a problem with the circulation, then you have to move forward providing the drug therapy. If there is a bradycardia, means abnormal or the slower heart rate than normal. So these are the drugs that are most commonly given: epinephrine or the atropine sulfate. These are the drugs which stimulate the sympathetic nervous system, and they also stimulate the heart rate as well. So epinephrine is said to be the heart rate stimulant. Electrolytes, as we know that the electrolytes are essential minerals like the sodium, calcium, and the potassium, and they're vital for the normal functioning of the body. If there is a lesser quantity of these minerals inside the body, a lot of problems and the conundrums arises with them. And lastly, here is a fluid therapy, and in the fluid therapy normally normal saline is given, and as we know that the almost 70 to 90% of the body demand is the water, right? And in the water there is the sodium as well, that makes the normal saline inside the body. So their normal quantity is very important for normal functioning of the body. And as we know that there is a homeostasis inside the body. To maintain the homeostasis, we most commonly provide the fluid therapy to the animals, right? So provide fluid therapy to patients for many reasons, such as the correction of dehydration, expansion and support of intravascular volume, and correction of electrolyte disturbances, and encouragement of appropriate redistribution of the fluids. So this is all about the A, B, C, D, E, and F of the intensive care. Hope you understand this. Meet you in the next lecture. Thanks for watching this.